Hi, welcome to today's episode of Kids Town Corner. Today we're going to talk about the top probably 3 things that we do here at Kids Town Pediatric Dentistry. What are the 3 most common dental procedures?
And believe it or not, probably the most common thing, and people are going to think we're crazy because people are like, why would you do that? You guys should want kids to have cavities. That's how you guys make your money. But honestly, the most common thing that we do here at Kids Town Pediatric Dentistry is try to prevent dental cavities from even occurring in the first place. So the most common thing we do is we try to get our patients to come in and see us every 6 months. So we can do x-rays, we can do cleanings, we can apply fluoride to the teeth, we can educate our patients and their parents on problem areas where we can see that they need a little extra help. So the most common thing we do, and the majority of our patients that come in each day are coming in for preventative reasons.
Yeah, that's so true. Yeah, we probably do 25, 30, 35, cleanings and exams and x-rays a day, that many different kids. So that's by far our most common thing we do. So big focus on prevention there. Another thing that is very common that we do for prevention is when those 6-year molars come in, we do those protective sealants where a lot of people will get cavities in the grooves of those teeth. If those grooves are really deep, man, it's hard to keep those clean. Food packs in there. We all know how the Oreos pack in there when you can make it look like you've got Oreo cavities, after you've eaten Oreos. In those grooves, they stick in there. And so these sealants can get those grooves from really deep to more shallow. And so we do lots of those because those are great prevention for those permanent teeth that you're going to have your whole life. So that's another very common procedure that we do.
And we'll get questions on those sealants a lot. Hey, do you ever do sealants on baby teeth? And the answer is yes, we can do sealants on baby teeth where it's appropriate. A lot of insurance companies will cover the costs of sealants on permanent teeth, but they won't cover the costs of sealants on baby teeth. So it's kind of a case-by-case basis when it comes to the baby teeth. If we've got a patient that seems to be struggling in that area and getting cavities in those areas, sometimes we'll recommend the sealants on the baby teeth. Just want to be able to justify to the extra additional, out of pocket cost to the parents, whereas other baby teeth might be really shallow with not a lot of deep grooves there, and it's kind of hard to justify putting sealants on those teeth. But great question, but we definitely recommend it on all of the permanent teeth. And then in addition to preventative, the most common thing we do each day is restoring dental decay or dental cavities.
Yeah, we unfortunately still despite everyone's best efforts to try and prevent cavities, there's still a reality, something we see a lot, and really the majority of the fillings that we are doing on those darn in-between cavities that for a lack of flossing, if we're not flossing really well, if we're eating a lot of sugary snacks, drinking a lot of soda or drinks that have high sugar content, all those things in combination with not flossing really well can factor into getting the cavities in between your teeth. And a lot of time those darn cavities travel in pairs where the nature of being between 2 teeth, it'll affect both of them. So lots of times when I'm doing a filling on one tooth in between, the neighbor tooth has one next to it. Not always, but a lot of times. So that's, unfortunately, if we're talking about the top 3 things or so that we procedures that we do here in the office, that would be another one where we are definitely doing fillings between teeth quite often. So floss your teeth because it'll help. and the more we can reduce that, the better off everybody is. So
yeah. And it seems like both of those, that we talked about, those common places for cavities, in those grooves on the top of the teeth like Dr. Brett talked about, and also down in between the teeth like Dr. Brett talked about, it seems like it's mostly the molars in the back. Not always. We do see cavities on the canines and along the incisors in the anterior area, but it seems like the most cavities that we see, it's those molars in the back. So pay extra attention when you're brushing and flossing your child's teeth to those problem areas in the back of the mouth.
So now you know pretty much what we do all day, every day here. Hope you've enjoyed today's episode of Kids Town Corner. Hopefully it's been something educational. If it's been beneficial to you, please share with your friends. If you have questions or comments, please put them below. We'll get back to you. Thanks for joining us. We'll see you next time.